President.
Senator from California.
Thank you, Mr. President. Mr. President, colleagues, I rise in support of this proposal to extend the ACA tax credits, extend the existing law for another year, reopen the government, and give us time to negotiate the longer-term extension of the Affordable Care Act. This whole discussion, and frankly the whole debate we've been having over the last several weeks over the Affordable Care Act, brings me back to the immediate aftermath of the passage of that bill when I was doing sidewalk office hours inside the Glendale Galleria. I had my little coffee table set up there and had someone come up to my table and ask me how I voted on that bill, how I voted on Obamacare. And when I told him that I voted for it, he was indignant. And he said, "What could you possibly have liked? What could you possibly have liked about that bill?" And I said, well, actually, there were a lot of things I liked about it. I liked the fact that if you had a pre-existing condition, you could get health care. I remember another of my constituents saying that he was 65. He was a pre-existing condition. I liked the fact that if you had a kid who was 26 or under, you could keep them on your insurance policy if they didn't have one. And then I said, and I like the fact that tens of millions of people that can't otherwise afford health care are going to be able to get health care. And he looked at me and said something that I never imagined I would hear. He said, and you really think that's such a good idea? That is, that millions of people can't afford health care would be able to get it? And I said, well, yes, I do, don't you? And he said, no, I don't. If they can't afford it, they shouldn't have it. And I recognized the moment he said it that he was speaking for millions of people. I'd had one of those huge town halls with 3,000 people, and no one would say that even at those screaming town halls. But his view was if they can't afford it, they shouldn't have it. And I think that view is really at the center of this debate. In the wealthiest country in the world, does the government have any responsibility to make sure that health care is accessible to people? I think we do. Now, who are these millions of people that are going to lose their health care if we don't extend the ACA tax credits? Well, let me just share the stories of two of them, of my constituents, who wrote to me. The first one said, my bronze HMO high deductible plan is $752 per month, and using most but not all of the tax credit, my monthly premium is $200 per month. That's using $552 worth of credits. I'm single, I'm currently single and retired, so my income is well within the limits to qualify for the credits, but if all the credits go away for 2026, this will wipe me out. And I will likely go without insurance, even though I know that's not a good idea. And here's the story of a second constituent. Anyone else gotten their health plans rates for 2026? I did today, and I will have to cancel mine. With chronic conditions requiring daily prescriptions, weekly doctor visits, quarterly labs, and biannual mammograms, my share of cost will go up well over $1,000 per month. And as a senior on a fixed and low income, I could not possibly come up with $1,000 a month. Sadly, there are so many seniors who will be in this position. That's who we're talking about here. These are some of the millions of people that will lose their access to health care if we don't extend the ACA. So I urge support for this. As Leader Schumer said, we can reopen the government today if we can simply extend the tax credits for another year and give us time through a bipartisan commission to work on a more permanent extension. I urge support, and Mr. President, I yield back.
Senator Adam Schiff took to the Senate floor today voicing support for a proposal to extend Affordable Care Act tax credits for another year. The plan, he explained, would reopen the government and give lawmakers time to negotiate a broader, long-term extension of the ACA. Schiff reflected on the ongoing debate surrounding the Affordable Care Act, recalling conversations he had shortly after its passage. During a public outreach event, a constituent challenged him on why he supported the law. Schiff explained that protections for people with pre-existing conditions, allowing young adults to stay on their parents' insurance until age 26, and expanding access to health care for millions were key reasons he voted for it. However, the constituent responded by questioning whether people who cannot afford health care should have it at all. Schiff said that moment made clear that there is a fundamental divide in the nation, whether the government has a responsibility to ensure that healthcare is accessible in the wealthiest country in the world. Schiff then shared stories from constituents who rely on ACA tax credits. One retiree explained that without the credits, her monthly insurance cost would rise from $200 to over $750, a change she simply could not afford. Another senior with chronic medical needs said that losing the credits would increase her costs by more than $1,000 per month, forcing her to cancel the insurance she depends on. Schiff stressed that these are not isolated cases. Millions of Americans stand to lose coverage if the credits expire. He urged the Senate to pass the extension, reopen the government, and allow time for bipartisan work on a permanent solution. He concluded by calling on his colleagues to support the measure.